Good morning, everybody, and happy Thursday. Today is Thursday, January the 28th. Welcome back to your Lunch Break Live. My name's Ivana if you are new here, and we're back in my studio dash office after covering tornado damage in Fultondale all week. But I thought it was important today to get back to a topic that we haven't touched on this week, and that is coronavirus vaccines. I know so many of you have questions, like we all do, about this vaccine rollout and exactly why Alabama is not doing great at this rollout. Today, I have our own one of our coronavirus vaccine reporters, Sarah Whites-Koditschek. She is here to tell us why Alabama's vaccine rollout has been so bad. She wrote a story earlier this week about that. I'm going to link it here in the comments so you can read it and get your full information there. But Sarah, that was a fascinating story, and it really kind of shined a light on the fact that the CDC ranked Alabama as the worst vaccine rollout state earlier this month.
Yeah, Ivana, a lot of states are struggling with the rollout. And so for a time, Alabama was the worst. It has been one of the slower states to get started for various reasons. Some of the challenges of the rural nature of the state, the demands that hospitals and other healthcare providers are facing right now with coronavirus cases being at their all-time high in the last month. So it has been a difficult start to the vaccine rollout in Alabama.
Now, something that I thought was interesting that you had in this story is a comment that, and I'm looking because I took my notes, that we don't even know how many vaccines have really been given out across the state. Is that true?
So the state now, so there's been a lot of confusion, especially last week. There was confusion about how many the state had given out because there's some kind of technological glitch / if you hear it from the hospital association, it's a technological glitch. If you heard it from the health department, it was that providers and doctors and hospitals weren't properly updating the system. They may have gotten more on the same page, but basically some of the systems aren't talking to each other, aren't talking to the federal government. The state relies on, it's called Imprint. It's a vaccine database that talks to federal databases that we use that for regular vaccinations. But that was going to be the main channel of communicating when shots were given out. So yes, there's been a lot of confusion, technology not working right, and confusion about how many vaccines had even been given out.
Now, there's also been a little bit of a confusion, even from people that I've talked to personally. There was a initial ranking system, we'll call it, of who was going to get their vaccine and in what phases. Those phases were 1A, 1B, 1C, and phase 2. Now, something that I think a lot of people were expecting, including myself, was that when 1A was done, we moved on to 1B. When 1B was done, we moved on to 1C. That has not been the case. Right now, the state is giving out their vaccines that are available to people over the age of 75, and they are continuing to work to vaccinate healthcare workers. Those were all people in that first group. Now, 75 was in a lower phase, but I believe that they're calling it 1A plus right now. Sarah, it doesn't seem like they're going to be able to flip a switch and move on to that next phase. Is that the plan, to just keep going kind of miniature phase by miniature phase? Or when are we going to see a little bit more of opening in this eligibility?
My sense is probably not very soon. And, the CDC, the federal agency that gave advice to states, got together a panel of experts from around the country, and they spent months really scrutinizing, who should we give the vaccine to first? Should it be the people who have, seen the most deaths, or should it be frontline workers who we need to keep society going? And it was this huge bioethical conversation with all these experts, and it was very, very well thought out and carefully laid plans with these groupings, reconstructed, debated, and then reality set in. And when the states tried to follow those plans, it didn't quite go very well. So Alabama, the first group was frontline healthcare workers. With the vaccine that we had, the Pfizer vaccine that required the ultra cold storage, we had to rely on hospitals. And there's very tricky requirements for that. Like they had to come in huge doses. They had to be given out with a certain time of taking them out of the freezer. And then it was just a lot to plan. And so the hospitals couldn't do that very quickly with the staff they had right now. We started to see a lot of people getting upset about that because, Alabama was ranked low in terms of how many vaccines had given out. And other states were in the same boat. So state officials said, you know what, let's open this up. We have all these elderly people that want a vaccine. Let's invite them to come get these because we're not able to give them out. We're not able to give them out too quickly like we had hoped to our frontline healthcare workers, all the other people we had identified as a top priority. So that happened, but there was no, say, online sign-up system in this state like there are in others to schedule a vaccine. There wasn't even actually a call center until around the time that they made this announcement. So there was no centralized plan to coordinate the distribution. There was also a combination of a lack of actual supply with some facilities that had supply that they hadn't been able to give out. So it kind of created this perfect storm where we were trying to solve one problem, and then we created another problem, which is all these people are like, okay, it's my turn. My grandma wants a vaccine. I'm going to call the health department. I'm going to call 100 times because I'm not getting through. And then so they got several million calls within the first weekend to the phone line. So now people are frustrated and they're having a really hard time. And they're, there've been vaccination sites where people shown up and no one was there. Just a lot of disorganization that was, meant to solve a problem that's a real problem, which is we want to get the vaccine out and get people immunized as soon as possible. I hope that answers the question.
No, it definitely did. And that was something that I found fascinating. You had anecdotes from people who went to a location, I believe in Shelby County, where they arrived to get their coronavirus vaccine and found an empty building, nobody even there. And I'm guessing that was an address issue, but that just kind of goes to show the disorganization, as you put it, in this system. Now, you also mentioned that Alabama Department of Public Health hotline. We do know that this hotline, unfortunately, has not been working for most people in the sense, like you said, people are calling 100 and 150 times and only getting either a busy signal or not getting through. Sarah, I know that they were expecting to open an online portal soon. From our knowledge, that is not open at this point. Do we have any idea rather when the portal will be open?
Last week they said it should be any day now. So we're waiting on that portal.
So I'm making sure to look at our latest coverage. Had a comment from somebody asking if Governor Kay Ivey had asked President Biden for more doses. We do know that 4,000 doses of the coronavirus vaccine have been relocated in Alabama by our health officials. And I do know yesterday when I was in Fultondale covering the governor's visit, somebody asked if she had spoken with President Biden about the vaccine situation, and she said that she had. Sarah, do we know when we're going to get any more doses of this vaccine?
So my understanding, the state's now getting about 50 to 60,000 doses a week of vaccines. There are orders with the companies in place, at least 100 million doses Biden's promised over the next, or the 100 days since he was inaugurated. And Johnson & Johnson is a vaccine maker that is on the cusp of getting their vaccine approved, which could be a game changer. That vaccine only requires one dose, whereas the other two we rely on right now, you need to. Mm-hmm. So it's possible, and there's reason to hope that things could speed up maybe in the next month or so.
I'm looking through a couple of our comments here. And one that I find interesting is somebody asked about, Sarah actually said, give the vaccines to Walmart to administer. Sarah, that was actually announced just pretty recently that the state had announced a partnership with Walmart to deliver those vaccines. But at the same time, as Sarah and I were saying, if we don't have the doses of the vaccine to give, even places that are approved to administer them can't actually give them. Now, Sarah, you made a comment in your story that I thought was really interesting and kind of sobering, and that was that your eligibility does not mean they have a vaccine for you. I know right now, if you go on the Alabama Department of Public Health's website, there's a bit of an infographic set up that shows, I don't know if you can see on my phone, where we are. And it says we're in limited supply for healthcare workers and long-term care facilities. And then it has going down the next groups. But just because you get in a group, say 65 and older, 75 and older, that doesn't mean that there's a vaccine with your name on it waiting on you.
Yeah, we only have vaccines here for a very, very small percentage of the people who are eligible. And, kind of big picture, when Biden took office, his people found that there was no vaccine rollout plan actually in writing, and so they're starting to do that now. What we've seen is a lack of federal response or federal direction to the state, where the entities that know how much vaccine is coming, in theory, could be the ones like giving it to Walmart to distribute or bringing to the state to distribute. But we're seeing a disconnect there. And then also on the state level, the state is kind of not centralized its rollout either. So you have these local entities planning their own process. It's like the feds kind of kicked it to the state kind of kicked it to the local level. And that's why you have like places like Mobile that are like, well, like we'll just have a day where everybody can just come and get in line and we'll give out the vaccine. But what happened a couple weeks ago when they did that on a Saturday is people who weren't eligible got in line and got the vaccine. So I think that there's a lot of moving parts, but it seems like it's a process that might be streamlined and improved more and more as time goes on, I guess, is the upside.
So I'm glad you mentioned that event in Mobile. Recently, there was an event, I believe in Silicaga, where it was open to people 65 and older that had a underlying medical condition that could get a vaccine. And that was, from our understanding, we'll call them extra vaccines that needed to be used before they went to waste. Sarah, do we expect more local places, more municipalities to be kind of flexing those rules a little bit to get rid of vaccines and get those in arms before they expire?
They are allowed to give them out if they need to. And there's a waiting list, like kind of an emergency waiting list that the health departments are keeping. If somebody doesn't show up, I'm going to call so-and-so and just ask them to come get this.
That's interesting. Now, I'm looking at a comment from Faye, and she says Alabama needs to have an online registration for appointments. This is 2021. And Faye, I think that so many people have said the same thing, that it's 2021. We should have a website up. And the ADPH says that is coming. They say they're working on it, and it should be coming. I believe they said any day now. Now, Sarah, I had another question here from, I believe, Neanna. Excuse me if I'm saying your name wrong. And she's asking, why even get the vaccine? What's good is the vaccine going to do with these new variants that we have of the coronavirus? Now, Sarah, I know that you're working on some reporting around that. Can you respond to that?
Yes. So for what we know, the UK variant, which has been identified in Alabama, the vaccine will still work with that. Moderna and Pfizer have said that they are confident that their vaccines will work with the variants. There's some unknowns, and actually I'm reporting on this right now. There's a new, this variant in Brazil that there's some questions about whether a vaccine would work with that. Moderna and Pfizer have the ability to rewrite their vaccine when they need to. So that is hopeful that if variants do become dominant that are different enough that they need to, that they can still, hopefully, and it seems like they can still rejigger it.
Is this rollout problem a federal problem, or is this a state problem?
Well, that's a matter of perspective, but like I said, I have talked to some public health experts that think that something of this magnitude really does need to be, and ideally would be, like coordinated from the top down by the federal government.
I got a comment from somebody asking if there are more vaccines in Alabama that are waiting to be given, or if we're just completely out of doses. Do you have that answer?
Yeah, so I think the state's given about half, and the rest, they say, are have someone's name on it. And the reason that they do that is because the state doesn't know how many doses it's going to get at any time, and has gotten a lot less doses than it's been told it was getting at different junctures. So it's been very difficult to plan. And those hospitals where they're giving out the vaccines, they need to schedule certain people to get the right people in. So they have made commitments to certain people to honor, that, and that's why they're holding onto those doses temporarily to give to those people.
Interesting. I'll take a quick sidestep of this comment from Debbie. She's saying she's 68 with underlying conditions and can't get an appointment. Debbie, right now, they are not even working on that 65 and up. Technically, these eligibility is open to 75 and up. We did mention that there was a event earlier, I believe this week in Sylacauga, that was open for people 65 and older with a medical condition. But that was one of those events where, like Sarah mentioned, these localities are allowed to just use the rest of their vaccines before they expire. We're seeing some places do that so they can just kind of get rid of them and make sure that these vaccines don't go bad and they get used. Sarah, is there a way for people like Debbie or other people who might be in that next step down on the eligibility chart to monitor when different places are maybe doing these first come, first serve type events?
That is a great question. So at AL.com, we have been reporting on the rollout. The Department of Health does have a map on their website where you can see the different providers and where they are, and you can contact them. So that might be a place to start. And that is unfortunately also some of the information that hasn't been well organized up into this point. So a lot of people are asking those questions, unfortunately. Some of our neighboring states do have those kind of websites, and we would, probably benefit from something like that.
Question from Jessica. She says, is Alabama fighting and working to get more doses of this vaccine? Are they actively seeking those, or is this just a situation where we have to just wait and see what we get?
All of the states are seeking more doses. And they're getting them based on the population in the state. So I think there's only so much Alabama can probably fight for, given that everybody's kind of in that same boat right now. And it's just a matter of how quickly they can make the vaccines at the federal level, unfortunately.
I was looking, here's the comment I was looking for. This was a little bit earlier, but I wanted to touch on it. And this is about the second dose of these vaccines. We know that Pfizer and Moderna both require a second dose. And Lisa says, my mother's in a nursing home and received her first Pfizer vaccine. Will she be able to get a second? She's 83. So I think the root of this question, Sarah, is for people who have received that first dose of the vaccine, is there a second one on hand at the state level that has their name on it?
Okay, well, that's a great question. So at the nursing homes, those rollouts are being organized. Actually, that is the one part of this that is federally organized through pharmacies like CVS and Walgreens. And so those pharmacies should have scheduled a second dose for the people they gave the first dose to. As for everyone else, yes, the state needs to give them a second dose, and it needs to be within a certain time frame. And we're just at the point of seeing like how they're going to do that. But yeah, that's the plan.
So Lisa, I would call that home, that nursing home or long-term care facility where your mother's at, because like Sarah said, that's a federally organized rollout there. Now, I got a question here again from Thane saying that Georgia's offering doses for 65 and up, and you can cross state lines. Thane, you're right. We actually, John Sharp and I worked on a story that is up on AL.com about people traveling across state lines and getting their vaccine. So we have more information in that piece. If you would like it, I'll try to link it here for you when we get finished. But that is correct. And we have seen several people that have traveled across state lines to get their vaccine. This is a good question from Murray, and I'm not sure if you know the answer, Sarah, but I'm going to throw it at you anyway. Murray says, if the second vaccination is available on their scheduled date, do you have to start all over with the first round, or do you just have to get a second one as soon as you can?
Wow, that is a great question. I will honestly not venture into that because I'm not a doctor, but that is a question that we will look into.
Murray, we'll make sure to ask some of the medical professionals that we've been interviewing for these stories. We'll ask that question because I'm not sure about the answer for that one. Now, Danielle asked, can you go in a different state and get vaccinated? Yes, Danielle, you can go across state lines to get vaccinated, but unfortunately, it doesn't seem necessarily easy in any state to get a vaccine. I think that's fair to say. Danny has a question, Sarah, that I think everybody is kind of asking, and he says, why are we still on 75 and older. Do you have any insight as to maybe a time frame where we'll get past 75 and older and down to 65 and up?
Okay, so all I can say is we have, I think, about 300,000 people in that category and about 300,000 people in the healthcare worker category. So how many months at 50,000 doses? We've gotten, I think, around 500,000. So, I mean, I don't know how long, just doing the math, would it take to get through 600,000 people with, I guess we've gotten enough doses for about half that group. And if we're getting 50 to 60,000 a week, you can do the math. Maybe within a month and a half, in theory, we'd have enough doses for that 75 and older group. I'm just throwing this out there. And then it would make sense to move on to 65 and older in the other groups once we've had enough. So that's kind of the best I could offer there.
Do we expect, as we get more doses in, for the state to continue to hold back a second vaccine as more and more people get their first?
Well, so the Biden administration has encouraged states to actually shift approach and just don't hold back doses. We're bringing you more, we're going to bring you more and more. Just get them out there, because once people get their first dose, there is a pretty strong level of immunity that's already accomplished with that first dose. So I think the strategy is, although the second dose is necessary and important, let's make all the progress we can right now and trust that our system is going to work and we're going to get the second doses when we need them.
Now, I'm really interested about the amount of people who are interested in going out of state to get their vaccine. One of my wonderful producers dropped the link to that story I was mentioning in this comment thread. So you can read that story, get a little more information. If you have questions, definitely email myself or John Sharp on that story about going across state lines there.
There's an article about this couple that flew of their private jet to Alaska, and they pretended to be hotel workers. Anyway, they're being prosecuted, so it's not recommended, but they went to a Native American reservation to try to get vaccines, pretending to be local hotel employees. Crazy story, but there are some criminal or legal, I guess, gray areas or ethical gray areas around that question. But I guess states aren't, at this point, they're not restricting vaccinations to residency, which your story was very good and explored that whole question.
Well, yeah, I would definitely recommend you don't go somewhere and lie about what you're doing or about your age, et cetera, to get that. But so definitely we'll definitely end this with the kind of the golden rule of tell the truth and just be nice when you go to get your vaccine, and definitely understand that there's a lot of people who are in line trying to get there. So that's a good point from you, Sarah. Definitely don't lie to try to jump ahead in that group. Appreciate you bringing that that little bit of common sense into this video.
Yeah, and double mask. Apparently we need to double mask now while we're waiting for our vaccines.
I think it's, just to end this with a little levity, Sarah, I have bought so many masks throughout the past year. I probably amassed 20 at some point, and I think I know where 4 of them are. So I guess it's time to make another order. If you're like me and if they have disappeared, I kind of held out because I was hoping that I wouldn't have to do another order. I wouldn't have to keep wearing them. But unfortunately, we are going to have to keep wearing them, it looks like, for a little bit. So I need to place another order for some masks. So I have a feeling I'm not the only person in that boat.
Well, I just got a new one. But I'm guessing yours are actually color coordinated and all in the same place.
I have plenty that are leopard print. I'll leave it at that one. Sarah, thank you so much for coming on, kind of explaining this. I know this is a topic that so many people are interested in and just have questions on. But I think it's safe to say that once we get a online registration portal, that our readers and our audience will be the first to know about it.
Absolutely.
Awesome. Sarah, thank you so much. Everybody watching, thank you so much. Thanks for keeping up this week with us throughout all of the news we've covered, and we will see you tomorrow.